I'm Joel Gorna, and I'll be talking to you today about pain. Specifically, I'm going to talk about the difference between acute and chronic pain and how to think about the difference. So, having worked in pain, I can vouch for the common experience of feeling like I'm miscommunicating about pain, that I'm just not seeing eye to eye with patients and I'm not communicating effectively. So, as we find ourselves in the situation now where we are taking steps away from our reliance on opioids and more toward interdisciplinary treatments and integrative treatments, I think it would be good to get more effective in how we communicate about these topics so we can better help patients who are really struggling. So let's start first with how pain ordinarily works. Typically, as you incur injury and you have some sort of tissue damage to the body, pain will peak when the injury is also at its peak. As you heal, as your body kicks in and the resources of the body allow you to heal, the pain wanes along with it. And they track pretty well. Not as perfectly as this image might show, but they track pretty well. Think about how this is different than the situation of chronic pain. So with chronic pain, the felt experience, the subjective experience of pain becomes more divorced from the healing process. And there are a lot of definitions of chronic pain out there that rely primarily on just how long it lasts. But I think a more functional definition looks at what's going on in the body as this occurs. So I prefer to think about chronic pain in these terms. Chronic pain is pain that persists beyond expected healing. When people experience chronic pain, as this image shows, people tend to have good days and bad days. Sometimes for obvious reasons, they've moved more, or there's some external situation that's provoking them. But it's often also internal. It's stress, emotional experiences, life experiences. And so people have good days and bad days, and the chronic pain has its own course that seems to no longer track with healing. But think about this for a second. Putting aside your knowledge and expertise in healthcare, think about what this is like from the patient's perspective, right? How does the patient know if they're healing or not? What is their basis for knowing this? Typically, aside from what you can see or detect from your senses, we typically infer whether we're healing or not, whether we're getting better based on how it feels, the symptoms we're having, and frankly, pain is the primary one. So in a situation where the pain peaks and then comes back down to baseline levels, we infer that the injury is healing also, which is reasonable. Now think about what happens in this situation, right? Your primary indication of what's going on in the body is your subjective sense of comfort and pain. What happens when it fluctuates and it doesn't go back to baseline? What do you infer about what's going on with the injury? I would say it's pretty reasonable to infer that something is wrong. And patients often think, well, I'm not healing. Or I healed, but then I re-injured myself. Or maybe there is another process going on. Maybe I have some other condition happening. And so people start to look for solutions and explanations for their pain. All of this, at some basic level, is a pretty reasonable thing to do, especially when the pain persists for years, like chronic pain often does. It can last for a very long time. So, another place where I think some confusion can occur is that from the patient's point of view, their personal experience is that their pain is not getting better over time. They have good days and bad days, but on the whole, it's not getting better. Then through their interactions with healthcare providers, they're told that there's no indication that the problem is still going on. It appears they've healed. Their knee, their back, their condition seems to be okay structurally, and that they can start to resume normal activities. But again, their subjective experience is that something is still very wrong. So in that space, in the difference between your subjective experience of pain and what you're being told from healthcare providers, that vast space is a pretty good chance that what's being experienced there is sensitization. Sensitization occurring peripherally, maybe at the source of the injury, but actually throughout the nervous system and even centrally in the brain and the nervous system. So this is sort of a learned change. The nervous system itself has changed. Now, this difference is a huge difference if you think about it from our point of view. As healthcare providers, what we recommend in terms of strategies are going to be very different if we think we're treating sensitization versus treating recurring injury. And so we need to have ways to communicate this difference effectively and clearly, ideally in ways that are not stigmatizing. And so that's the challenge I think we're left with today, is to start to formulate better ways to communicate about this difference.